Welcome to Report from Washington with your Congresswoman, Eddie Bernice Johnson. Each week, your representative invites policy experts to join her to discuss the issues that affect you the most here in the 30th District of Texas.
So I rise in strong support of H.R. 362 for 10,000 teachers and 10 million. This legislation is designed to strengthen our nation's scientific competitiveness. We do right and good by this country. When all of us assembled here this evening understand the magnitude of this moment. The time to act is now.
The Pledge of Allegiance will be led by the gentlewoman from Texas, Congresswoman Johnson.
And now, Congresswoman Eddie Bernice Johnson reports from Washington, D.C.
Hello. Today we have a very interesting guest. This is a report from Washington. And our guest is Dr. Margaret Zeigler. She's the Deputy Director of the Congressional Hunger Center. And the Congressional Hunger Center is a non-profit leadership training organization that trains the next generation of anti-hunger leaders. She founded the congressionally funded Mickey Leland International Hunger Fellows Program, which she currently oversees. She works closely with members of Congress on hunger issues, and she helps direct the CHC in the management, budget, supervision, and fiscal administration. She holds a PhD in Geography and International Development from the University of Cincinnati, and she is a graduate of Miami University. We are delighted that you've taken time to come.
Thank you very much for having me.
Mickey Leland was a very dear friend of mine. We started in the House together. As a matter of fact, January 3rd, 1973, Kay Bailey Hutchison, who was Kay Bailey then, and Mickey Leland and I all took our first oath together for the first time. We were all elected to anything, and that was to the Texas House of Representatives. Right. And we remained such good friends and did lots of things together. So Mickey was very, very popular, very sensitive, very caring, and he called himself a citizen of the world, and that he was.
He was. What I remember the most about Mickey was just his ability to embrace people, to bring them together around issues. His best friend, one of his best friends in Congress, was Bill Emerson, a Republican from rural Missouri. Just about as different from Mickey as you can get, yes. But they were best friends.
And Jack Fields. They used to ride together, and they were very dear friends. Party didn't make any difference. He was on a mission to be of help, and he never let that pass. So tell me a bit about the Hunger Center and its history.
Sure.
And how are you doing now?
We are doing well. We are fighting hunger by developing leaders. This is our aim, our mission. And we were founded back in 1993 by Congressman Tony Hall from Dayton, Ohio, and his good friend Bill Emerson, and Frank Wolf from Virginia. And it was a bipartisan effort. We are not part of Congress, even though our name sounds like we are part of Congress, but we are a private nonprofit bipartisan organization, and we train leaders and we advocate for policies that create a more food secure world. Well, we must be experiencing a big problem right now, and our prosperity is at its low ebb. How many about in the U.S. that don't have enough to eat? Well, it's the timing for us to have this discussion today is perfect, because just yesterday the USDA released a survey, a major annual survey that they conduct on hunger and food security in America. And unfortunately, the news is not good. There are now 49.1 million Americans who experience hunger on a regular basis, and this is up. This number is up. It's increased since the last time the survey was done. It's very unfortunate. It's not a good trend, and in fact this is the highest number since the survey has been done, which began back in 1995. They conduct it on an annual basis, and since 1995 this is the highest number of Americans. It's 1 in 6 Americans now that experience hunger and food insecurity on a regular basis. They're not starving, but they every month, at least every month, they experience difficulty feeding all the members of their household. And this, in America, in the 21st century, is really a shame.
How do we measure up to other developing countries?
Well, developing countries, unfortunately, many of them lack what we have in the U.S. right now, which are good safety net programs. We do have hunger in America, but we also have safety net programs where people can turn to both federal assistance, state-level assistance, and private charities. We have a decent safety net system that many developing countries don't have. And we have wonderful programs to support particularly child nutrition in the U.S. Unfortunately, overseas, what we're seeing, especially in the last 2 years, with the increase in food prices and with the financial crisis around the world, this has really impacted poor people. In the U.S., we spend probably about a quarter of our budgets at the most, maybe between 5% of our budget and up to a quarter of our budget on food. In the developing world, particularly in the rural areas, many poor people spend up to 70 to 80% of their incomes on accessing and buying food. So it's much more dire in the developing world, and very few countries have what we would consider good safety net programs to help people in times of crisis.
And so that's why I guess you see so many nutritional needs, and the health status of many of the developing countries is not very high.
Malnutrition in particular in many parts of the developing world is almost at a crisis level. I just was in Guatemala in March of this year. It's a very short flight from Texas. And if you go to the capital of Guatemala, Guatemala City, you see, you know, people seem to be fairly well fed, living okay. But you get just a few hours outside the capital, and it's a different world. You see child stunting, which is a term we use in the nutrition community, which means that the child has not grown high enough for the age that they're at. Some places, 70 to 80% of the kids are stunted. What this means is that you can't reverse those malnutrition issues. The impact on the child's brain and on their height, on their physical abilities, is permanently impacted. So sometimes it's too late to reverse these malnutrition impacts.
Now, is hunger an issue with poverty?
Poverty and hunger often go hand in hand. But what can make the difference, even if you're from a poor household, is if there is a safety net to help you. You can still access some food even if you are poor. And in the U.S. we do have wonderful safety net programs. We have school meal programs for children, school breakfast, school lunch programs. We have the food stamp program, which is really a lifeline for many, many families. We have the Women, Infant, and Children program. These are all federally funded programs. In the developing world, some of the coping strategies that people have are to migrate in search of work. Maybe they go to the capital and try to find work. Maybe they go to another country to try to find work. Or they may turn to less nutritious foods. Or they may share food in the household. Or they skip meals, or maybe they sell some of their assets. Like if they have a pig or a goat, or they may sell that to try to get cash to buy food.
Well, it's really, when you really think about the fact that there are so many families and so many children without food, because many times if parents work away from home, they can manage to eat something. But if they can't bring something home, the children are still hungry. I know a few years ago, statistics came out, about 2 years ago actually, that Texas had more kids going to bed hungry than any other state.
This is correct. This was, in fact, I think it was just a recent study by Feeding America, which is